Brought to you by the medical professionals at Carpal Pain Solutions, developers of the Carpal Rx.
If you have hand or finger pain, numbness, and tingling, you probably have carpal tunnel syndrome. And right now you might be considering surgery, whether by endoscopic or open release surgery. You're considering surgery is a major decision, and you should know all of the facts as you make that decision. One fact is that the National Institutes of Health recognizes that carpal tunnel syndrome is a serious musculoskeletal condition. And the NIH, as well as the Association of Orthopedic Surgeons, have instructed doctors to tell their patients to try all non-surgical options before considering surgery. The reason is because most people who have carpal tunnel surgery are not satisfied with their results, whereas the vast majority of people who have non-surgical therapy are quite satisfied with their results. The NIH's National Center for Complementary and Alternative Medicine says that deep tissue massage therapy is highly effective for these conditions. And every year, the NIH publishes studies showing how effective deep tissue massage is on carpal tunnel syndrome. To understand why deep tissue massage is so effective on carpal tunnel syndrome, we must understand what causes this condition. It's actually a disease that affects an area inside the wrist known as the carpal tunnel. Inside the carpal tunnel, your flexor tendons, here shown in white, are very close to the median nerve, here shown in yellow. The tendons are surrounded by a fluid-filled sheath, here shown in blue. Under certain conditions, like rapid hand movement, that sheath begins to swell and it pushes against the median nerve. And that causes all of the symptoms of carpal tunnel syndrome. Therefore, for any remedy to be effective and lasting, it must solve the problem of swelling inside your carpal tunnel and not just mask the pain it causes. If you're one of the millions of people who have carpal tunnel syndrome, it's important to know that you don't need surgery to get rid of your pain and other symptoms. Most people get 100% complete and lasting relief using deep tissue massage therapy. Now, this isn't your ordinary massage. Pressures are directed outward from the wrist with every circular motion. This results in drainage of fluid from inside the carpal tunnel, as well as breaking up the adhesions that caused the inflammation to begin with. Most importantly, to be effective, this treatment must be performed daily and for a period of 2 to 4 weeks. Otherwise, it won't be able to alleviate your symptoms. But thanks to a new technology, you don't have to see a therapist every day for this treatment. This technology is the Carpal Rx. You place it on your forearm twice a day for 15 minutes. It's carefully calibrated to produce the same motions, speed, and pressures that a therapist uses to perform deep tissue massage on your wrist and forearm. And it's so simple to use. Just plug it in, slide it on, and strap it in. Then relax. The Carpal Rx will do the rest. So get rid of those splints and braces that just don't work. The Carpal Rx will be the last product you buy. It comes with a true 100% guarantee because it targets inflammation. The Carpal Rx always had and always will have a 60-day risk-free trial, which means if you're not satisfied for any reason whatsoever, you get a full unconditional refund of all of your money, including return shipping costs. If you suffer from carpal tunnel syndrome or wrist tendonitis, you have nothing to lose by trying this remarkable product. Remember, it's the only product backed with a 100% guarantee to permanently and easily get rid of carpal tunnel syndrome, wrist tendonitis, or repetitive strain injury. Learn more at carpalrx.com.